Respiratory therapy is a great career, not only for high school students, but anyone to consider, because we are the life and breath of the healthcare profession. We are there doing births when people are taking their first breath, and we're there, unfortunately, at the end when they're taking their very last, and everything in between. I like to tell students that we help patients work for every breath, every day. Moraine Valley prepares students to become respiratory therapists by providing them cutting-edge education with didactic skills, clinical skills, technology, using all of our resources with our clinical affiliates and clinical partners to really educate them to be a therapist of the 21st century. Medicine is changing and changing rapidly, and we have to be able to keep up with the pace. The majority of our graduates go directly to the hospitals. Some go to clinics where they do pulmonary function testings. Some actually go to home care where they do what we call durable medical equipment, and so they work with the patients that are home on ventilators, home oxygen, things like that. And then others sometimes go to clinics and doctors' offices.
Since progressing in my field, I've worked in pediatrics now in a critical care team. So we go all across the United States and the city of Chicago, picking up sick kids, bringing them over from our hospital. We can take an ambulance, a Learjet, and even helicopters and bring them over to our place, help them feel better.
During a student's tenure in the program, they can get hired as a student respiratory therapist, and that is hospital by hospital. And so what happens is the hospitals will hire them for like equipment cleaning or general respiratory therapy, like nebulization therapy, oxygen therapy, to work with the patients. So they can do that while they're in the midst of their program. We're just always cautionary to our students to let them know you're a working student therapist, so continue to make sure that you get the appropriate grades to continue on throughout the program, and so you can graduate. Most of our students, after their first clinical rotation, usually have a student placement job. Respiratory therapy is rewarding because you are essentially the life and breath of the patient. There is nothing more rewarding to see a patient who has stopped breathing and your efforts have revived them.
I absolutely love my job. I wouldn't trade this in for the world. It makes me feel like a superhero. Just without any powers or any of that stuff, just knowing that whatever's in my heart, I can actually do something to help somebody.